While a highway work zone is not considered a high-risk area for infectious diseases, universal precautions can and should be made to prevent their spread between workers, supervisors, visitors, and the general public. The three primary ways in which we can protect one another from the spread of infectious diseases, such as the flu, SARS, MERS, and COVID-19, are job site screening, social distancing, and sanitation. It is everyone's job to follow these steps to make certain that we're all protected. These simple processes will go a long way in keeping you, your crew, and your family safe during an outbreak of an infectious disease. Let's talk about job site screening. Based on recommendations from the Center for Disease Control, the best way to keep distances from spreading is to keep an infected person from entering the worksite. Since there's no way to work from home on a road construction site, workers who report to a job during a health pandemic or serious disease outbreak will need to enter the site. Before doing so, a person appointed by the employer should consider asking each worker the following.
In the last 14 days, have you or anyone you know been in direct contact with a person who has had a confirmed case of an infectious disease, including COVID-19? Have you or anyone in your family been in direct contact with a person who is currently being tested for a disease? Have you traveled internationally, been on a cruise, or in an airport in the last 14 days? Have you had symptoms of the disease in the last 72 hours without the use of medication? If the person answers yes to any of these questions, he or she should be sent home and not allowed to return for 2 weeks. Contact the employee's supervisor immediately and follow your company's policy for sick workers.
Next is social distancing. Social distancing is a way to restrict when and where people can gather and how close together they should work. Social distancing is meant to stop or slow down the spread of an infectious disease. Working on a roadway project doesn't often put you right next to another person, but occasionally you'll need to speak and interact with others. Following basic protocols for social distancing, keeping 6 feet apart from others, and not gathering in groups larger than 10 will significantly mitigate potential exposure. Here are some tips for you and your employer to help you continue working by practicing social distancing.
Continue morning exercise, toolbox talks, and safety meetings, but in smaller groups with individuals 6 feet apart. Use a megaphone or other amplification source if needed. Keep in-person meetings short if there is no other option, such as a phone or radio call, and maintain appropriate distancing. Take turns viewing documents or plans if there is not a digital version or hard copies for everyone. Eliminate community food options such as lunch buffets, donuts, etc., and discourage workers from sharing food. Remove community microwaves, water dispensers, and coffee pots during the duration of the disease event. Provide water bottles and individual portion containers. Expand break spaces as much as possible within the limits of the internal traffic control plan to provide more safe distances for workers. Stagger shifts and break times to schedule fewer workers on the site at the same time to reduce exposure. Restrict access to confined and enclosed spaces like trailers and any spaces that use recycled air.
Finally, sanitation. Thorough and consistent sanitation, including regular cleaning of all shared surfaces and a strong attention to personal and group hygiene, is your last and best line of defense against an outbreak or pandemic of an infectious disease.
According to the U.S. Surgeon General, the best form of personal sanitation is regular hand washing. To the extent feasible, employers should provide hand washing stations that are separated from porta potties and break areas. Hand sanitizer is not universally effective. When washing your hands, follow these universal precautions. Turn on the water with the back of your hand or using a glove. Then, wet your hands slightly. Using soap, rinse your hands fully, front and back, for at least 20 seconds. Finally, using the back of your hands or a glove or sleeve, turn off the water. Wash your hands every time you come in contact with another person, before and after breaks, after using any tools or equipment, and immediately after entering or exiting the work zone. All shared tools and surfaces, such as steering wheels, knobs, levers, etc., need to be properly sanitized after each use. The preferred method is a cleaning fluid, not just a disinfectant wipe. Your employer should provide this for your use. Proper PPE is essential on any job. Use it. Wear it properly. If you are issued a mask for dust or pollutants, such as an N95 mask or greater, wear it and dispose of it properly after use. Bring your street clothes and a plastic or laundry bag with you, and store them in your vehicle. Before returning home from the work zone, change into your street clothes and store your work clothes in the bag. Wash if needed, or rewear your work clothes as appropriate. Be careful not to take contaminants home to your family or loved ones. Cough or sneeze into a tissue and discard the tissue in the trash. If tissues are not available, cough or sneeze into your upper sleeve or elbow, not your hands. Try to avoid touching your face.
In conclusion, these simple guidelines will go a long way to keep you, your family, your crew, and your workplace healthy and free from infectious diseases such as COVID-19. Remember the 3 key steps: job site screening, social distancing, and sanitation.
And if you feel sick, call in sick. Don't take risks that can harm someone else you know, or even someone you don't know. It's just not worth it. Stay safe and healthy at work.